Yes, my name is Johan Lundin. I'm a medical doctor by training. I work at the University of Helsinki, where I'm a research director for the Institute of Molecular Medicine Finland. And then I have a position also at Karolinska Institute in Stockholm as a guest professor of medical technology.
And your specific interest in M-Health, where does it come from, and what are you doing in M-Health?
Yeah, I'm personally and as a researcher, I'm interested in new diagnostics. So that has been kind of the main theme in my research, and especially diagnostics where you utilize new technology, like from informatics and from microelectronics, from ICT. So that, and especially, of course, for improvement of patient care.
And specific projects that you're working on in this area? Would you explain?
There are quite a few projects that I've been involved in, but maybe one that I would like especially to bring up is mobile microscopy. Because the microscope is a crucial instrument for diagnostics, and it has so far been tied to the lab. So now when you can use novel innovations within technology, you can create microscopes that can be brought out of the lab, closer to the patient and closer to the point of care. And then you can utilize this technology to improve the access to diagnostics. And especially if you can create a low-cost device, low-cost system, you can improve healthcare in low-resource settings.
And the technology that exists so far to do that, does it give you that kind of high enough resolution, good pictures, good images? Are we there yet?
We are not but we start to be quite close. So we have developed a set of prototypes that come quite close to a laboratory level microscope.
And they're based on mobile phones?
They are based on components or components from a mobile phone. So we try to use these inexpensive components, and that's much due to the huge development within the mobile phone industry, because that has, for example, revolutionized the camera. The camera in a mobile phone we carry now is an extremely sophisticated piece of technology that has been put into a package and made so cheap that many of the cameras in the mobile phone costs in the order of a few dollars. Maybe the most expensive ones in the high-end phones can cost still less than $20. So, and imagine that you use this component that is crucial for creating the picture for microscopy purposes. Then you have the possibility to really create something that could be low cost. Maybe not in dollars, but still maybe in the order of a cost of a smartphone.
Okay. And what would be the advantages compared to normal laboratory-based microscopies? Besides, you've said low cost and getting it out into rural areas. What else? What other advantages?
Yeah, I think that now, as it is now, the patient typically has to go to the lab to give a sample and to be analyzed. So now we can do the opposite. We can bring the lab to the patient. And that is going to change how you can perform diagnostics.
And what are the challenges?
I think the challenges are probably related to how to integrate this new technology with the existing and the workflow. Many labs have certain workflows, certain ways of processing the samples, and if you want to test something new in this environment, it has to have a good fit with the existing.
Yeah, absolutely.
Well, I understood from the discussion earlier that there are a number of prerequisites to really make it work when we come out in these areas like connectivity, electricity, and things like that. So what are the real main challenges to bring this type of technology and products and support out in the rural areas?
I think the connectivity has been improving also during this project that we started maybe 5 years ago. It has improved every year. So we are currently testing the prototypes that I mentioned. We are testing them in rural environments in Tanzania and also in the capital city. So we have seen how the mobile networks during this short period of time have improved. So the first tests were quite limited with regard to connectivity. We had a limited speed of the network, but during the last visit, especially closer to Dar es Salaam, for example, already now is 4G network available. And 4G means a kind of a digital highway with regard to images, because microscopy is images. So we want to transfer the data also for remote diagnostics. And as soon as that network is available, it improves the way we can do it. But we have also, of course, still challenges. The rural hospital, where we would like especially to test this technology, has still limited capacity. And I have
limited human capacity or limited?
Both. I think especially with the connectivity. Okay. So, and I have tried to sort out how this could be improved. I have some colleagues, actually also from Finland, who have been building the infrastructure in Tanzania. And I asked my friend that how we have this small hospital 70 kilometers outside of Dar es Salaam. We know that there are mobile networks there, but how could we improve the speed? And then he told me about the ways you could achieve this. You could install maybe a new base station for receiving maybe better signals. But he also told me that probably it would require more investment in the basic infrastructure of maybe even landborne cables to really have the high speeds.
How much can you compress these images to limit the size of them?
Yeah, we are able also, due to novel developments within image compression, we are able to compress them substantially, meaning that we can still keep the diagnostic important features in the pictures, but we can compress them maybe even to 1% of the original size, which means that we can use also networks that are limited, but the faster the better. And we are also developing this technique not for today but also for tomorrow. So we foresee that sooner or later the connectivity will be much better also in these regions.
What about the human side of it? Do healthcare workers need special training to use these, the components they're going to add? I mean, do they have access to smartphones, all that kind of thing? Do they have to be taught how to use it? The aim is to make it as easy to use as possible. So it should require less training than using a microscope, because that is one really important aim. If you want really to scale it up and make it available and useful, it should be easy to use. The current prototypes are not yet that easy to use, so we need to do a lot of work on that side. But of course it helps now, since many of applications that are developed for mobile phones, the whole process of developing a user-friendly interface has improved. So we can kind of borrow ideas from the regular apps to try to make it as easy to use as possible. And also the whole idea, I think, is also not only to replace current instruments and labs, but also to empower the persons working at the field to use
this kind of technology without that much skills. So that's really important.
Yeah, yeah. Wait, I mean, if you could overcome all the challenges, how far do you see it going? I mean, how, you know, what are the possibilities?
Yeah, personally, I would like, because if you go to a lab anywhere, medical lab, anywhere in the world, there is always a microscope.
Yeah.
So what I would like to do is to replace that analog visual traditional microscope with a digital similar technology that would replace it, but would also add what can be added value from the digitalization is that we can start using also intelligence augmentation by automation. So when the image is in a digital format, we can apply novel techniques from machine learning, from artificial intelligence to do what the experts do by eye. And not replace the experts, that maybe comes later, but to start with to support the healthcare system by making it more effective, by analyzing samples, by screening samples with computer vision. And we have published
to traditional methods.
Comparing them, of course, yes, that's always an important. When we introduce these new methods, we always compare them in scientific studies and compare them with the conventional, traditional methods, because that is definitely needed. But we already know that, for example, microscopy, traditional microscopy, is challenging, and also with human-based experts. So human experts also make errors and mistakes. So that's why the machine should also have a possibility to compete or support the human, and maybe have the human make less mistakes, because machines typically do things that can be repeated. So if you feed exactly the same image to an algorithm, it gives you the same answer. That's not the case with a human
Machines
observer.
learn by the mistakes, we don't.
Yeah. Or actually, what I have found very interesting, since I work now with these artificial intelligence projects, is that it's both ways. So we shape the tools, but the tools also shape us. So when we train, new algorithms for diagnostic purposes, we see that the machine makes errors, yes, but we also notice that our own errors, that the machine has even done a better work.
Sure.
So it will be both ways.
It's interesting.
I was just thinking when you're talking about artificial intelligence and so on. What is your view on using augmented reality to support people actually in using these new tools?
Yeah, I think that the augmented reality, especially from the point of view that you have let's say a remote expert being present and showing, being connected, that I think is also a field that will evolve. Because now, as you know, how we communicate has changed a lot during the last few years. First we had text messages, then there were chats, then you start to share pictures. Now many, especially of young people, they share live feeds, or they share short videos. So, and communication has become like part, not so that you first do work and then communicate. You kind of communicate all the time. So communication is like part of living. You communicate all the time. So that's and that's much enabled by the connectivity and by especially the mobile, the smartphones, that you are able to from anywhere. I can like I did today. We had a meeting here at Stellenbosch and Stias, and I have been several times connected to my computer in Helsinki, and actually assisting some researchers there. So kind of using it as I would if I would be in Helsinki. So there is no kind of there is a lot of change going on in how you do this, and this should be part of healthcare also, and that was what we have been discussing during this roundtable here, that this should be considered by everyone working within healthcare, that this opportunities we should make benefits from them.